Greetings, I am Dr. Tammy Lee Demler. I'm a pharmacist here at the Buffalo Psychiatric Center. I am working with Dr. Samara White on creating these educational programs for you, and we hope that you are finding them to be very helpful. We're going to talk about medication side effects today, and with that, we're also going to be having a group activity that will allow you to interact with a pharmacist to be able to ask questions about side effects and to be able to answer questions that they'll pose that they've received as well on side effects. So we're going to move ahead here onto our next slide and get going. So the objectives for today are to define 5 things, or to talk about 5 things. The first one is, what is a side effect? So determining what that definition is, even though it can sometimes be a little confusing. We'll talk about it. The next thing is, how can these be managed? Because even if you have a side effect, you can manage it, and it can be managed on a number of different ways of managing it, and we'll talk about those as well. What to do if you think you're having a side effect. So after this program, you decide that perhaps you had a side effect or you're having one, how to have that conversation started with your doctor, nurse, or pharmacist. And as you think about in the past examples of side effects you might have had, that's also really important if you can share with the group today so that we can all have a better understanding of side effects. Examples of side effects experience. So I can give you an example of some that I've had, and again, maybe we can have a conversation between all of us to talk about side effects in general. But think about it while we're covering this topic today. And what else should you know about side effects? So we're going to move ahead and talk about that as best we can. And we'll bring up some of the antibiotic side effects that Dr. White talked to you about just a few weeks ago. So what is a side effect? The definition of a side effect can be different really for many different people. So we've had conversations here in our medical staff committees talking about side effects and what the definitions are to try to make patient care more safe, to make sure that we're doing everything we need to keep medication management to as safe as we can, because all medications have some degree of risk, but we all take them, and medications are good for the use that they're intended, but we need to know what to do if we have a side effect. So a side effect is what we would consider a secondary effect of the medication, or a drug treatment, or if you're getting a medical treatment. So side effects can be not only with medications, you can have a side effect perhaps with a procedure or some test results that you might end up needing. Let's say, for example, if you need lab work, you get blood drawn, and although the blood is drawn and evaluated, you might have a little bit of a soreness after that blood is drawn. So that would be a secondary effect of having a blood draw. These effects, whether you're getting side effects from medications or treatments, can be unpleasant. It can make you not necessarily feel that that was a good thing. I don't like having soreness after I get blood taken, but we know that it's important because the blood draw or that blood sample will be able to give your doctor some insight as to what's going on with your body, whether it's a medication or whether you're not feeling well. Your blood will be able to tell a story of what's going on in your body, right? So sometimes medications, this is another example, it can cause drowsiness. I would say that's a very common side effect of medications, whether they be psychiatric medications or medical medications. Side effect of drowsiness, or what we would call it sedation, can be unpleasant, or maybe it doesn't really fit into your daily regimen. If you're feeling sleepy when you're during the day and supposed to be awake, that's not necessarily ideal. It's unpleasant. However, we can sometimes take medications that make us sleepy or sedated before we go to bed, and that is really beneficial in many ways, because if you're having some challenges sleeping, or if you're not feeling sleepy before you fall asleep, a medication that you take for maybe your psychiatric condition or your mental health wellness can really help with that. The reason you're taking your medication for the primary reason, and then then having that secondary benefit of being sleepy or sedated can be a good thing. So another example could be Benadryl or diphenhydramine. Sometimes we use diphenhydramine for allergic symptoms. Sometimes we use diphenhydramine or Benadryl for muscle spasms. But during the day, you don't want to necessarily feel sleepy. So Benadryl can be used at night to make you sleepy as well. Again, sleep should be not entirely medicated all the time. We should be able to fall asleep at some regular routine experience, but sometimes we need medications to make us feel better. Side effects can also make taking that medication less appealing. So if you're taking a medication that is making you feel a side effect, if you don't have that side effect taken care of, you may not feel like you want to take that medication. So it's important to know what that side effect is and to be able to communicate with your doctor about what you think you're feeling, because it may or may not be the medicine, but if it is, then maybe that can be adjusted. And we'll talk about some options for adjustment in just a little bit. Side effects can range really from very bothersome and inconvenient and not very dangerous or serious to that which can be serious and that would need more medical evaluation. An example of that could be an allergic reaction. An allergic reaction to a medication can be unexpected, although in information we provide to patients, allergy to the medication is always possible. So we always like to try to say, if you notice any redness, itching, sometimes people who are very allergic to medication can have difficulty breathing or they get hives. Anything like that, of course, is very serious, and you need to report that because we would want to make sure you don't get that medication again for that particular side effect. But generally, side effects don't keep you from taking a medication forever. We just need to address it, find out what's causing it, and if it can be fixed. Some side effects that seem initially not to be very serious can become serious if they're left unaddressed or unreported. So an example of that could be clozapine and clozapine constipation, or constipation from any drug, for example. So if it's a few days where you're feeling like you're not able to go to the bathroom, you can feel uncomfortable, but it's not serious at that point for most people. But if it's a week or longer, that becomes a problem that needs to have intervention, or you can end up having some more serious problems with your bowels. So constipation, we take that pretty seriously. Here at the hospital, it's a team effort to be able to monitor that you're having a normal bowel movement every day, or to the degree of your normal movements, because everybody's a little different. But if you have constipation, you should report that to your nurse, doctor, and pharmacist. I will say that your nurse is right front line with you every day. They see you every day. Your doctor as well. Pharmacists are here in the hospital every day. You may just see us at treatment team or medication groups like this, but we're always available if you have any questions about your medicine. How can you manage medication side effects? You should know possible side effects before you start taking the medication. Now, when you're getting a new medication, you can ask the doctor or nurse, who you will see probably before the pharmacist, what can I expect from this medicine? You may want to ask, what can you expect both for the good, why am I taking it, and for the side effect possibility, what should I look for? You can ask them again about the side effects, but sometimes that information can be overwhelming. It's a lot for us to remember. You can always get some information that's printed from the pharmacy if you would like it. It's important to know that even old-time medications that you've been on for a long time can have side effects, and you may just forget what those side effects could possibly be. It's okay to ask about information for side effects, even if you've been on a medicine for a long time. I take medication and I sometimes forget about those side effects, so it's always good to take a refresher and ask about what are the side effects from this, even though I've been on it for a long time. What's kind of interesting is that the FDA is the Food and Drug Administration. You probably have heard of them. They are the organization that oversees drugs, safety of drugs, and approval of new drugs. And over time, they have developed processes and systems that help us inform patients, and we keep informed as healthcare providers about the safety of medications. And one thing that has come to market, or I would say has become available to patients, is something called a medication guide. Now, I would say these medication guides have been around probably, I would say, certainly over 10 years, but we've become more used to giving them out upon request and when we're giving out medication that requires a med guide. Now, you'd be surprised to see the medication guides and what they're available for. Some medications over the counter even have a medication guide. And the intent or purpose of these medication guides is to keep everybody just updated on the risk of the medicine, why the medication is being prescribed perhaps, and things that you can do as a patient taking the medication, or as I could do as a patient taking the medication, to lower the risk that I might have a side effect, or to take action, appropriate action, if I do develop a side effect. Now, the guides, I will show you what these look like because they're always the same. You can always expect the same look to these medication guides. And you can always ask for medication guides for your medication. Not all medications have a medication guide, but if you want information about your medication, that's a good way to ask about it. So whether you're here at the hospital or when you are in the community at the pharmacy of your choice, you can ask for a medication guide. And if the pharmacist says that there is not a guide that comes with that particular medication, there are other ways that we can communicate those risks or the benefits to you, because it's not all just bad news, right? It's about why the medicine is good for you to take. We'll be looking at examples of med guides today, so you can kind of take a look at that and we can practice together. These are some examples of side effects experienced. So what do you do if you think you've had a side effect? So we're going to talk about these specific bullets on the slide here, that many side effects are expected. So you are going to be getting a medication, or you're going to have a procedure, or maybe you're going to receive a vaccine. And that's an example of what I used today for our walkthrough, because I had a little bit of a sore arm when I got my vaccine this time for my flu vaccine. So medication side effects that are expected: I got my flu shot. I used my left arm because I write with my right arm. So I thought, well, if I get sore arm, then I'll be able to just shake that off and not worry about it so much. But I had a sore arm, more sore this year than other years, but it's just a different formulation every year. And maybe, I was a little bit more tender this year, but it went away. And how did it go away? I had to mention that I had a sore arm. And so with the next point here, most side effects can be managed. So what can I do if I have a sore arm with a flu vaccine? Does anybody have any idea? I'll let you maybe say something, a comment out in your group today. What would you do if you had a sore arm with your vaccine? Well, you could put maybe a little bit of a cold pack on that area. But I got Tylenol, and I took a little Tylenol, and it went right away, and it didn't bother me again. So just that little bit of a boost of something that took pain relief away, or it was a pain reliever, it took the pain away, that worked for me. But there always can be maybe non-pharmacologic, is the word we use, or non-drug interventions for side effects. So I could have maybe used a little ice pack, and maybe waiting the extra day, I could have maybe had less soreness. But again, if you're having symptoms or side effects, you should let somebody know. Sometimes with flu vaccine, we might get a little bit of a feeling of warmth, almost like a feeling of a little fever. It's just your body's way of reacting in a good way to that medication. It's building up its immunity. So we can expect that often side effects in that regard can be good indicators that the medication is actually doing its job. And I think that your pharmacist today is going to be talking about some side effects to specific medications when they do the activity with you. And part of that will be talking about blood pressure medications, and that side effects that you experience if on blood pressure medications can show that the body is actually responding to that blood pressure medication. Lower blood pressure, a little bit of dizziness, even though we've got to be careful, is a good indicator that sometimes that medication is doing its job. Not everybody's going to have the same side effects. So let's say, for example, my friend didn't have soreness in her arm, but she did have a headache after the flu shot. Now, I didn't. She did. We're both very individual people, and those are both side effects that can be expected with the flu vaccine. Again, Tylenol took the headache away, but maybe waiting an extra day could also have been an option as well. Again, we don't want anybody to be uncomfortable when taking a medicine or receiving a treatment, so tell your doctor, nurse, or pharmacist, and we'll make sure that we try to help you. Completely unexpected side effects can be considered what would be known as an adverse drug reaction. So absolutely unexpected, or something that maybe hasn't even been reported before. If you're feeling something, say something, and then we can look into that a little further, because it's possible, even when drugs are on the market for a long time, that you can have a reaction or an experience that's different than other people. And we want to take that seriously and make sure that you're safe and that you're taking your medication as ordered. So your doctor may not know you're having a side effect unless you tell them. There are occasions where they will see that you're having a side effect. In the case, for example, if you had an allergic reaction to an antibiotic, you're going to obviously have some rash or hives or something to that degree. So that may be more visible to them. But if you're having feelings of drowsiness, dizziness, or other feelings like headache or nausea, we wouldn't necessarily know that. So make sure you let them know. Having a side effect from a medication is common, but side effects can be managed to allow you to take your medicine comfortably, not only to keep you healthy, but also to make you comfortable so that you don't have to experience that side effect on a regular basis. Things that can be done: your dose can be changed, possibly based on what it is and why you're taking it. Sometimes the time of day you're taking your medication can be the answer. So swapping that around, and now you can't do that here at the hospital on your own, but you can talk to your doctor about that as an option. Giving the medication with food or asking for some food with your medication can help with stomach upset. And sometimes it doesn't even have to be a very common side effect for stomach upset. It might just be you and having your stomach upset by your medicine, and giving it with a little bit of food can help. And sometimes if we can't change that side effect while you're on your medicine, we can give you a similar medicine that will do the same thing with the very little side effect that's related to the same medication that you're taking currently. So just a slight switch may be the answer. So again, asking if you feel something, say something, and we'll address it for you. These are some examples of common side effects with medications. Medication that you take for blood pressure, I've already mentioned. You can sometimes get some dizziness. Drowsiness, possibly. Lightheadedness would be another description, but be mindful and remember that I said sometimes these side effects are really an indicator that your medicine's doing the job it's intended to do. So a lower blood pressure makes you feel a little bit lightheaded sometimes. If you've ever had a warm bath where you've been in the bath for a long time and you get out of the bath, you feel a little lightheaded because your blood pressure is lower, because your veins dilate to help sort of keep your body temperature normal. So that's an example, if you've never taken a blood pressure medicine, of how blood pressure medicine can sometimes make people feel. Antipsychotic medications may cause tremor. So if you've been on antipsychotic medications for a while, even lithium can cause a tremor that usually goes away. But we know that sometimes patients, we can have a medication that causes tremor for a long period of time, but that doesn't mean that if you have to sort of just go with that. Sometimes we can change up the medicine, give another medicine to offset the tremor, but again, tremor, you need to report that if we don't already know that that's happening for you. Patches, things that you apply to your skin. We have a lot of medication that comes as a patch now. Instead of taking an oral medicine, you can apply a patch. The patches, because of the adhesive and the formulation of that patch itself, it can cause some skin irritation. I gave an example of nicotine patches here because a lot of us are taking those nicotine patches to prevent smoking withdrawal, right? Smoking nicotine cigarettes is not healthy. But when you stop smoking, you need most often a little bit of a nicotine replacement to curb that withdrawal from nicotine. So many people here at the hospital are on nicotine patches. But the patches can cause irritation. So rotating the site, meaning changing the site on a regular basis, helps make that better. But if you're having some irritation, it could also mean that you're reacting to that glue that sticks that patch onto your skin. Ibuprofen can cause stomach upset. So that's probably no surprise. I would guess that many of us, if not all, have tried ibuprofen for pain or swelling at one time. And would bet that you are told to take it with food. And that would be correct, because not only can it upset our stomach, but it can cause some irritation to the stomach if you don't take food with it, if you take it on a regular basis. And I just threw another medication out there in case any of you are on it. Atorvastatin, or Lipitor, for cholesterol, can sometimes cause muscle aches. Now, muscle aches that are sort of mild are not usually a problem, but if you have serious aches, especially in your legs and your calves, that can be a problem. So you need to let your doctor know. Report aches either way, and then we can help determine whether or not that needs additional action. Now, I promised you I was going to share with you some med guides and some way that they look. This is a simple way of looking at a med guide, and you can see that all the med guides that you receive would look the same. It tells you what the most important information is. What should you know about this drug? Now, drug XZ, or whatever this is not real. This is just a pretend drug. What is the drug? Who should not take the drug? So there are some people who shouldn't be taking a specific drug, and it'll show you. And I'll give you a real example of this in just a minute, but just know that if you're looking at this, it goes step by step. It says here, before taking drug, tell your healthcare provider about these conditions, medical conditions, and if they include you. How should you take the medicine? How should you what should you avoid or not do while you're taking the medicine? What are the possible side effects? So that's what we're talking about today. So you would want to hone in on that, because it'll tell you what are the possible side effects with it. It'll also say how you should store the drug, and that might be another educational program I can develop for you, because that drug storage is really important. When you take a drug home with you or wherever you're residing out of the hospital, you'd want to make sure that that medication is stored properly, at good room temperature, stored with a cap on so that it doesn't have any chance of being exposed to the air or light. So storage of medicine is really important. Some medications need to be stored in the refrigerator, and here it should tell you that as well. General information about safe and effective use of this drug. So there may have been some information that has come to market that talks to you more about that specific element, and you need to know about that. And what are the ingredients? So obviously the drug X would be included in this drug, but there are also things that keep, for example, a tablet together or a capsule full. So if you were to look at a capsule of medication, the medication that you're taking, for the reason you're taking it, is a very small, I can't say it's very small, it's a portion of that powder in the capsule or the tablet that you're taking. A lot of that otherwise could be filler. It could be cornstarch, it could be coloring, it could be a sweetening agent. So what we like to have you look at, and we look at too, is that if you're allergic to anything, if you're lactose intolerant and this medication has a lot of lactose, maybe another formulation would be better for you. For example, many people who are lactose intolerant can tolerate a small amount of lactose in a capsule, but if you're taking 10 of them a day, then that may become a problem for you. So just know that there are inactive ingredients, but all of these ingredients are listed for you, as it would be if you were eating a Twinkie or a cupcake or something like that, or something more healthy like a Nutri-Grain bar. All of those ingredients will be listed for you as a consumer to be able to know what you're taking. This is an example of a real med guide. So as I promised you, here we have something for ibuprofen, and it's under the non-steroidal anti-inflammatory medications. So that's a long word for the medication class that it's in: ibuprofen, naproxen, Aleve. All of those things are under this particular umbrella. And many of you, if not all of you, including myself, have taken this medication. So I'm going to point out what this says, and we'll talk about it for a little bit. So what is the most important information about this medication called a non-steroidal? We call them NSAIDs for short, if it's easier for you as well. So it may increase the chance, and this sounds scary, of a heart attack or stroke that can lead to death if you use a lot of NSAID medications in people who have heart disease. So while it sounds like that's a scary sentence, they tell you who really would be a person to be concerned with that particular medication. Non-steroidal medications should be let me just read here my glasses, should never be used right before or after heart surgery. Okay, so usually if you're having heart surgery, you would have somebody watching over you so that you wouldn't have to worry about that. It can also increase the risk of ulcers and bleeding in people who have conditions such as that. And it says that they can happen without symptoms. So people, again, taking nonsteroidals can have a risk of these scary side effects if they're patients that are at risk of these things. Most of us aren't at risk of these things and we don't have to worry. But what I like about these NSAID or these med guides in general is that you have the ability to read it, and then you know, and maybe you're reading it for somebody else that you know who is asking you to do this. So here, the chance of risk of getting a person getting this ulcer or bleeding event could be longer use if you're a smoker, if you drink alcohol, if you're of older age, and that'll be eventually all of us, so we'll all have that as a risk factor. But if you also have poor health. So again, looking at what are the chances and how you can reduce the risk of those side effects. So how can you use it, or how should you use a nonsteroidal? Exactly as prescribed, at the lowest possible dose, and for the shortest period of time needed. And I would say most of us probably are doing that. But again, it's a good reminder, many drugs that are on these med guide lists have this same kind of just very, very practical information for you. Now it tells you what the medication is. So this is the important part. It tells you why it's good. So different types of arthritis, different kinds of cramps and other pain, short term. I'm going to move to the next page here. And so they list that who should take these medications, also listed. If you've had any kind of these are people who should not take it. I'm sorry. If you've had any kind of bypass surgery or any kind of stroke, if you have an allergic reaction to this type of medication, that's important that you also avoid it. Things to tell your healthcare provider. All of these great things to be able to tell your healthcare provider, all your medical conditions, whether you're pregnant or nursing, talk to your doctor. These are side effects now, serious side effects that they list, serious, and then they have other side effects. So let's go to the other side effects because you're probably going to more likely experience those than the serious ones. Stomach pain, constipation, diarrhea, gas, heartburn, I can't read the other one, vomiting, nausea, there we go, and dizziness. So those are the common side effects that people can have, but and that would be not serious most of the time. But serious heart attack, stroke, high blood pressure, heart failure, all of these things to the left are pretty serious and very more likely rare than more common, but it's important for you to know. And then it says get emergency help right away if you have any of the following symptoms. Shortness of breath, could mean you're allergic to it, chest pain, slurred speech, any of the things, a swelling of the face, that could be allergic reaction as well. And then again, stop taking your NSAID and call your healthcare provider right away if you have any of these symptoms or problems that they have listed there as well, but I don't need to read that to you. I'm going to ask the pharmacist perhaps today to bring this med guide with him to have you read it so you can see what ibuprofen med guide actually looks like, and then other NSAIDs that may need a prescription. Ibuprofen you can get over the counter. So med guides aren't really available over the counter. It's only by prescription. But whenever you're at a pharmacy, you can always ask the pharmacist for this information. They'd gladly help you with that. Now, I'll just mention to you also that what else should I know about these side effects? And these are back to Dr. White's presentation to you. Antibiotics can have interactions and then sometimes cause side effects that result from those. And we'll talk a little bit about some of those things. Taking medications that can cause stomach aches or stomach pain. She gave examples of those, so take it with some food. She has an example of that, I think, a little later. Darkened urine, you just want to make sure that you're going to want to, not use contact lenses. She mentioned not to be alerted to that concern because it's pretty normal to have bodily discoloration. Sometimes when you urinate, when you're taking antibiotics, it can be orange colored, but that goes away after you're done. And then sometimes using sunscreen when you're taking antibiotics because you can get a rash, an exaggerated sunburn when you're on these medicines. And these are things that Dr. White talked to you about, so I'm not going to spend too much time doing that because we have a little quiz to talk to you through and make sure that you know what you're getting into with our activity with our pharmacist today. And then this was just a little bit of talking relative to diarrhea. Antibiotics can cause diarrhea. I'm sure that you remember Dr. White talking about serious diarrhea with some antibiotics, but maintaining good gut health while you're on antibiotics can help with that as well. But signs of allergic reaction, that's a side effect, a serious adverse drug reaction. We need to know right away if you're having any trouble breathing, swollen tongue or lips. Typically, allergic reactions are a little less serious initially. You get some rashes or hives, but you need to let people know right away that you're having that reaction so that emergency help can be sent to you if needed. Sometimes we just take a little bit of Benadryl and we're fine. Discontinuing the antibiotic and changing it to something different is the answer. So let's do our little quiz for today. What are side effects? So you have a few options here. A, the name of the medication. B, how a drug is expected to work. C, often expected secondary effects of some medications. Or D, a report the FDA files annually about medications. Which of those do you think is the definition or how we would describe a side effect? Did you guys pick an answer? Did you like C? Awesome. C, often expected secondary effects of some medications. Very good. True or false? We'll keep it simple now. A side effect can make taking your medication less appealing. True or false? What do you think? Can sure make it less appealing, absolutely, but don't despair. Things can be done to make that better, and you can continue taking your medication for the intended purpose for your wellness. Here we go. True or false? Side effects can be managed if reported to your doctor, nurse, or pharmacist. Can they be managed? Yes, they absolutely can. Sometimes the management may be required to give you a different medication. That might be the option, but we like to do things to keep you on that same medication if possible first. So you may expect some adjustments and some changes to the medicine to see if you can tolerate it better. True or false? If you have a side effect from a medication, you can't ever take that medication again. Is that true or false? What do you think? Never take it again if you have a side effect. False. False with a little bit of a caveat, and the caveat means with a little bit of an exception. If it's an allergic reaction, you should never take that medication again. But everything else, generally speaking, would not prevent you from taking that medication again. You just may not want to take the medication again if it was changed because no other way was it to be able to be modified to make it appealing for you to take it or comfortable to take it. But it doesn't make you not be able to take it again. And then this is some from Dr. White, just a way to correctly take antibiotics. What can you do? Take it with plenty of water, skip doses to make you feel better, use antibiotics as often as possible, or double the dose if you don't feel better. And this one is an easy one because you've done this already. Take with plenty of water, but avoid milk and dairy. And which of these antibiotics can cause orange body fluids? It should never be bloody. Orange body fluids. Metronidazole, nitrofurantoin, rifampin, or doxycycline. Do you remember? Rifampin. Yeah, so the other ones can cause a darkened urine, but rifampin can cause orange urine. Not a very frequently prescribed antibiotic, but if you've had it, you will remember that was the case. And that is the end of our time together. Thank you so much for joining us. I hope you liked this an awful lot, and I hope to see you again real soon. Take care. Have a great day.